At common law, a judgment non obstante verdicto would be allowed only when the plea confessed a cause of action and set up matters in avoidance which were insufficient, although found to constitute either a defense or a bar to the action, but the motion for such a judgment must, of course, be made after verdict, and the practice in such cases is very restricted. The motion will not be granted unless it appears from the plea and the verdict, and not from the evidence, that the plaintiff is entitled to the judgment. In science, reproducibility of results and replicability of methods are fundamentally important aspects of the scientific method. Some professors of science have proposed the idea that the idea of replication is based on the premise that there are empirical regularities or universal laws to be replicated and verified, and the scientific method is adequate for doing it, while conceding that scientific truth, however, is not absolute but relative to time, context, and the method used. An anomaly is defined as a pattern that defies the paradigm-induced expectations that govern normal science. Similarly, in law, testimony that is speculative, or which opines on the credibility of another witness, is not admissible, and speculative fear of future harm does not constitute an injury in fact sufficient to confer standing. Clearly, viral particles are by far the most abundant biological entities on our planet, and around the time of the emergence of MERS, in 2012, there were only a total of 219 viruses harmful to mankind. Hence, by simple probability, there would be low confidence of an emerging virus threat, this being infinitesimally small, when considering the law of large numbers. And yet, a pneumonia condition, attributed to an etiology, described as quite singular, had been discovered by Zhang Jixian, Director of Respiratory and Critical Care Medicine, at Hubei Provincial Hospital of Integrated Chinese and Western Medicine, FICM, who had noticed on December 27 that an elderly couple had large ground glass opacities in computed tomography, CT, images of their lungs, distinct from those she had seen in other cases of viral pneumonia. The National Notifiable Disease Reporting System, NNDRS, in China, was notified of 174 COVID-19 cases with onset of symptoms in December 2019, described as an extensive exercise by 233 health institutions in Wuhan. Some 76,253 records of cases of respiratory conditions in the 2 months of October and November before the outbreak in late 2019 were scrutinized clinically. However, 92 cases were considered to be compatible with SARS-CoV-2 infection after review, subsequent testing, and further external multidisciplinary clinical review determined that none was in fact due to SARS-CoV-2 infection, and world public health authorities had concluded, based on the analysis of this and other surveillance data, it is considered unlikely that any substantial transmission of SARS-CoV-2 infection was occurring in Wuhan during those 2 months. With the first reported fatality, occurring on January 10, 2020, about which public health officials in Beijing had concluded that there is no evidence that the virus can be spread between humans, and, as late as January 14, 2020, there were only a total of 41 known, reported cases in China, from which only a total of 27 cases had later been determined to have been connected to the Hunan wholesale seafood market, described as a scruffy complex of 1,000 stalls spread over an area the size of 9 football fields, the largest of its kind in central China, mostly supplying seafood to Wuhan's residents and restaurants. Further, in one inferential analysis, it had been determined that of the total 27 original cases reported by December 31, 2019, only 19, at that time, had been associated with the wet market. And yet on January 31, 2020, in a disproportional response, the WHO had set up the IMST Incident Management Support Team across the 3 levels of the organization, headquarters, regional headquarters and country level, putting the organization on an emergency footing for dealing with the outbreak. In a clear anomaly, national news had speculated about a possible snake origin for the novel virus, speculating a snake origin, a hypothesis confirmed by a rigorous analysis that had reported an Ophidian codon usage bias. However, while there are over 3,000 coronaviruses that infect mammalian species, and over 3,000 that infect avian species, there is no such thing as a coronavirus that infects reptilian species, while the president's former top medical advisor, together with many highly qualified vaccinologists and virologists, remains convinced that, although we keep an open mind that it's possible that it could be, as they say, a lab leak, that the most likely explanation is a natural evolution from an animal reservoir to a human. According to World Public Health authorities, in express guidance and major recommendations to countries with imported cases and/or outbreaks of COVID-19, they had been advised to fully educate the general public on the seriousness of COVID-19 and their role in preventing its spread, and Arlington Public Schools, on report of only 5 cases in the entire county, less than 45 within the entire state, with not even yet one fatality, had made the decision to close public schools to in-person instruction, at a time when China was being praised for reopening their schools after only a month of lockdowns, after finding the incidence of COVID-19 lower than the flu, affecting only 2.4% of reported cases in China, amounting to 19 times more cases than had yet been reported in the entire United States by mid-March 2020. This was a disease about which the WHO had stated emphatically while declaring a pandemic, "We cannot say this loudly enough, or clearly enough, or often enough, all countries can still change the course of this pandemic," and that, describing the situation as a pandemic does not change WHO's assessment of the threat posed by this virus. World Public Health authorities, who had declared the pandemic, had clearly stated, as major recommendations, that nations should maintain an appropriate level of emergency management protocols, depending on the assessed risk in each area, to ensure that economic activity resumes, movement restrictions are lifted, and schools reopen, based upon those boots on ground / eyes on the objective assessments of the threat, and had commended for having implemented, against a previously unknown virus, perhaps the most ambitious, agile and aggressive disease containment effort in history, credited with changing the course of a rapidly escalating and deadly epidemic. Yet, announcing astonishment at the reaction of world leaders, the assistant director for the WHO had announced, "People keep saying, the cases are the tip of the iceberg. But we couldn't find that. We found there's a lot of people who are cases, a lot of close contacts, but not a lot of asymptomatic circulation of this virus in the bigger population. And that's different from flu. In flu, you'll find this virus right through the child population, right through blood samples of 20 to 40% of the population." That report had expressly made the clinical determination that asymptomatic infections had appeared to be relatively rare and did not appear to be a major driver of transmission, while the author of that robust investigative report had specifically made the clinical determination that COVID-19 transmission in children appears to be limited compared with influenza, and had found that family clusters appear to have driven the outbreak, in addition to the apparently misunderstood clinical findings that, within healthcare settings, prisons and other closed settings, it is not clear what role these settings and groups play in transmission, and did not appear to be major drivers of the overall epidemic dynamics, suggesting some difference between the congregant setting of a household and a place available for introduction of the virus from the general public. And yet, today, while masks remain optional, APS students who test positive for COVID-19 will still be expected to isolate at minimum until day 6 and mask until day 10.
This message was approved by Major Mike Webb. Honest.
And y'all come back now. Yeah.